You said you saw a look on that guy's face, the kid that you had.
Yep.
I see that look on Kanye's face almost.
Absolutely.
And it's almost like whatever he's trying to tell us, we're not getting it. And will he give up?
It hurts my heart. It hurts my heart. So I do this thing where I will send a little message on Instagram. That's the only way I know how to reach people.
Welcome to the We Got Problems podcast with co-hosts Curtis G. Martin, Rhonda L. Brown, and Caliph Johnson Sr., the one and only podcast where solutions get discussed to our community's everyday troubles. Each week, you will hear mind-blowing conversations and actionable tips and strategies that you can implement in your daily life to become more effective. We got problems and we got solutions.
All right, you guys, welcome to the show. This is We Got Problems, where we also have solutions. And I'm here with my co-host, Rhonda L. Brown.
Hey, everybody.
My second co-host, Caliph Johnson Sr.
Peace, y'all. How y'all doing?
And we have a special guest here today, Joronda Montaño. Joronda, why don't you tell the people a little bit about yourself and what it is that you do?
Let's see. Well, first, let me start with thank you guys for inviting me to the show. I'm really excited to be here. I'm a Cali girl. I grew up in LA, went to Morningside High School, and then made my way to Arizona to go to Arizona State University to run track. And after finishing my track career, I just kind of found myself in behavioral and mental health and wellness, and trying to link mental health and physical health, because, you know, you really can't live without one without the other. So on a daily basis, I might be on a variety of school campuses working with youth or training teachers or law enforcement or medical staff or parents to help them understand what it's like to be a youth today, some things that we need to make sure that we're paying attention to, and giving some best practices on how to deal with some of the things that youth might encounter for the first, second, or third time. So that's just in a nutshell. I'm just kind of the life preserver, if you will.
So when you stayed in Arizona and you decided that this was you're gonna call home, what made mental health be the subject or the profession you want to get into?
You know, that's really interesting. Somebody told me a long time ago that like nothing happens in a career on accident, right? We find our ways to careers based on things that have happened in our lives, whether that be somebody introduced it to us or because we're trying to solve a problem that we saw consistently as youth, and we get to the older youth stage or adult stage. And for me, growing up in LA, I grew up in the 80s. You know, you saw the crack epidemic in the 80s. My mom fell, victim to that. And I watched her struggle with her mental health challenges. Now I know that's what it was. I did not know back then that that's what it was. But I watched her struggle through that. Very bright, brilliant woman who unfortunately succumbed to a disease. And then I didn't want to work with kids at all. I said, I don't want to work with kids because there was so much pain being a kid dealing in just everything that was happening in LA at the time. And little by little, I found that somehow I had this gift of having empathy and this gift of just wanting to be there and be with a person. I might not know your exact situation, but I get what it feels like to feel down. I get what it feels like to need somebody to talk to or to not want to talk to anyone. And so I credit my career to my mom and to my mom's situation and everything that I experienced as a result of what she was going through. And she always said, I want you to be amazing. I want you to be better than me. Always. She was always very proud of my sister and myself. And so that's how I found my way initially to prevention. And that's just trying to stop the problem before it happens. And then now I've developed that into something bigger. But yeah, that's the backstory.
Okay. So what kind of obstacles have you run into? Especially in the mental health field, like dealing with, all different kinds of people.
Yeah. 2 years ago, I was an executive in nonprofit for a really long time. And 2 years ago, I left and went on my own as a consultant. I founded a small organization. And what I realized 2 years ago, and this was on, just complete transparency, you all, this was sitting on the couch, clicking into YouTube. Somebody sent me a link and it was the George Floyd situation, and it hadn't hit the news. It was just, it had happened that day. And I'm watching this, not knowing what's going to happen. And we know the end of the story, right? And I realized at that moment, I had never been in front of a complete Black audience to talk about mental health. Here and there, I may have had Black people or people of color or people who don't identify as white in a session with me or in a presentation or a training with me, but I had never talked about those issues specific to our community. I'm a trauma specialist. I do historical and generational trauma, and I had never talked to a Black or brown audience, Black audience, let me say specifically. And so one of the barriers that I have found is that information, in my experience, it is not always getting to our communities before there's a problem. And, we can look at pockets where there are large numbers of Black people. 13% of the population in the United States is Black, identifies as Black. And that's like 46 million people. That's a lot of people. I've been to a lot of states doing prevention. And why? Why have I never been put in front of, or had I never been put in front of a Black audience? And then myself walking into situations where I'm the only one who looks like me. I'm the only color. I also wear a hijab. So I'm the only one, I'm usually the only one that looks like me when I walk into this situation. So people aren't understanding what I'm carrying also when I come into that room. And I just constantly had to stuff it, constantly had to put my things aside to make sure that I'm just there, what I signed up for, to be there for other people, and so that realization hit me really hard in 2020. And I was like, yeah, this is not okay. Like, we are strong, 100, we are strong, and we will continue to be strong. And sometimes that strength is a curse. And that's another roadblock.
Mm-hmm. So how did you get into suicide prevention?
I lost a student early in my career. He left the room, and I could tell he wanted to say something to me, talk to me. And I saw this particular group every Tuesday. I didn't have any suicide prevention training at the time. I was pretty much in substance abuse prevention. And I found out about lunchtime the next day that he had taken his life. And I was just like shocked, stopped, like, what in the world? And then just replaying through my head the night before, the look on his face, like I was going through all of this, like, what in the world? Why didn't I stop to say something for a minute? And for a second, I felt like, oh my gosh, not I'm to blame, but I could have done something, and then I realized I wouldn't have known exactly what to do. I need to go find out what to do. And from that moment, I sought out training. I became a suicide interventionist and have a couple of different certifications in suicide intervention. And now I continue to train others in suicide intervention.
Thank you for your service, sis. Really appreciate that.
I know, y'all. You know what? And now I have a question that's finna turn this that I don't think we had planned for. So, but what do you think about Kanye West and his situation?
It's real interesting. For a long time, I've been concerned about Kanye. And this is a long time. When his mother passed away, I was concerned about him. But even on the first album, I had been in prevention long enough to say, wow, that's a lot of trauma. Like this gentleman is going to be on a very public stage. How is he going to handle this? And over the years, we've seen some of the handling of that so many times. Let me say it this way. I try to make sure people understand mental health is health. It is health. We all have a mental health. There is a spectrum. Now, more than likely, as we get into cold and flu season, I'm probably going to get a cold. Well, thanks to COVID, I haven't really had a cold in a couple of years, right? Because I've been washing those hands like crazy. But more than likely, I'm going to get a cold. I'm going to get some sort of illness when we head into cold and flu season. Most of us will, right? Same thing happens mentally. There will be times where I will get a mental health cold or flu. It doesn't mean that I'm the cold or the flu. I just have this. I have these symptoms. I can deal with it. I know what to do when I'm sneezing or coughing. I might not know what to do when I'm feeling down. I don't really want to get out of the bed. I don't feel like talking to my friends. I just don't know what to do, right? But if we can handle health like health and catch it early, it's less likely for us to deal with growing like the exponential magnitude of mental health, which could become like a mental health cancer or, a terminal illness for mental health. And terminal illness in mental health typically is suicide. That's the terminal, like someone attempts or completes. I'm concerned about Kanye.
That's where I want to go. And I'm sorry, y'all. I know we had
No, please do.
set thing, but so you said you're concerned, and you said you saw a look on that guy's face, the kid that you had.
Yep.
I see that look on Kanye's face almost.
Absolutely.
And it's almost like whatever he's trying to tell us, we're not getting it. And will he give up?
It hurts my heart. It hurts my heart. So I do this thing where I will send a little message on Instagram. That's the only way I know how to reach people, to prominent people, to say, hey, I'm just sending you a virtual hug. I don't know these people. I don't know Kanye. I tried to send Kanye a message some years back. I don't know if he ever got it, but we have to listen and we have to say, hey, yo, bro, dude, whatever. I got you. I'm thinking about you, and not just thinking about everything that you've done or can't do. He is a human being. He is a human being, and every life is precious, and his life should be regarded as precious, just like the next person, whether we agree with them or disagree. And I do believe that we need to wrap Kanye in some love because he deserves some love. I don't know his whole story. We don't know everything that's going on when the cameras are off or the mic is off or whatever, but we do know some things that we see in public. And I'm not even saying that he has a mental health disorder. I don't know. I'm not a doctor. What I do know is that brother has had some trauma. He's had some losses. He's had some significant life-changing losses. And that is going to be heavy on anybody. I don't care how much money you have. It's going to be heavy. So if I could hug Kanye, I totally would.
Mm-hmm.
So you think the pandemic has had more of an effect on him and, even the children nowadays?
Yeah, the pandemic really did us. It really brought some things to light that were already there. And when you look at the numbers, what we understand now, like, for example, suicide, let's go back to that. At any given time in the world, 5% of the population is having thoughts of suicide. Does that mean that they have a clear intention to die? Not necessarily, but they're having thoughts of suicide. In the Black community, that's 9%. That has increased since the pandemic. That has increased. So being at home, having time to slow your brain down, having time to slow your activities down and just be able to sit and not do anything but sit and think and fester on things sometimes, that's going to bring some things to the surface. And those things have come to the surface. One of the issues that we're also having, though, is what do you do about it? And how do you help people?
Okay, so that leads me right into my next question.
Okay.
So how do you know when it's the proper time to go seek help or get some intervention in there?
Without going into a whole nother hour of how to do that, the quick is, if you're feeling down and just outside of yourself for 2 weeks or more, you need to seek some sort of attention. That may not mean you have a disorder. It may mean that I'm dealing with a serious flu and I need some help with this right now. Now, if that continues to happen consistently, 2 weeks here, a month here, and you look at the course of a year, and over a year, you're like, most of the time I've been down instead of up, you may need to seek a doctor and explain that whole situation. But 2 weeks or more, if you're feeling down for 2 weeks or more, you need to talk to somebody.
Okay, thank you.
Now, I hate to make this into a race thing, but we going there. Is there a difference in white kids, Black kids, or Hispanic kids when dealing with mental health issues?
There's a difference in the impetus. There's a difference in what has happened. So when you look at Black and brown, let's take Black kids. Let's just start here. Trauma can live in your DNA up to 11 generations. So if I go back in my family, 5 generations, the grandmother who was last enslaved was 2 years old before the family found out that they had been emancipated. She was 2 years old. So prior to her, that's 5 generations back in my family, right? So you continue to go back. I said 11 generations. Trauma can live in your DNA up to 11 generations. We're dealing with dehumanization of Black people. We're dealing with violence. We're dealing with oppression, and we're dealing with racism. So we have layers of trauma that we are trying to muddle through. And sometimes the reactions with trauma, because it's in your DNA, you don't know why you're reacting a particular way. but you're reacting because it's coded into you. So you have this intrinsic situation that is creating just like a knee-jerk reaction. If you hear it, like, oh, why do they act like that? Why do they do that? Stereotypical, sure, and historical. And let's say historical trauma, much of it. And we don't even know why. We don't know why. So yes, there is a difference. And you go and let's talk about Latino kids, right? When you go to the Yucatan in Mexico, I just watched Wakanda Forever, right? And let me go there. I had a big issue with the Black versus Brown, because you got trauma begetting trauma, right? And like on the screen for me, I was like, oh my goodness, these two traumatized communities. We saw the colonization, the picture, what was happening with the enslaved Mayans in the one scene. Do a spoiler if you guys haven't seen the movie, but we see that picture of that, and then you have pitting these two against each other for what? For who to do what? Like, that's not going to heal.
That's how Disney does it, though.
Oh my gosh, I was so like excited, had on my white and everything, and then I was like, oh, so we got to mourn some more. Like, when does it stop? Like, when are we going to get an opportunity to just simply be joyous, just to be joyous? We just lost the Black Panther, right? So yes, there is a difference. And you can have white kids who also have experienced historical trauma, because white is a construct. And if you have white kids who understand their history and have a connection and are not in an identity crisis, then they for sure may be able to acknowledge, or at the least have in their DNA, that trauma. Coming over at Ellis Island, it wasn't a great experience. The Irish had a hard time in the US. The Jews had a hard time so many places, and in the US, yes, that still exists for those kids. But when you remove the kid from the continuous daily addition of the dehumanization, the oppression, the violence, the racism, they are able to at least separate. And then some of their reactions just become like, oh, this kid is ADHD, or, oh, this kid has a hard time concentrating, or, oh, this kid needs more services because they're dealing with hard stuff at home, without regard for what might be happening in the past, in the history, and in the family,
So do you see more melanated people going to seek counseling? Because I know when I was growing up, it was almost like a taboo, like you don't do that.
Yeah.
Do you see changes? Do you think more people are going to seek help, or more melanated people are going to seek help?
I will say, with this generation of kids in school, I do see more kids being open to talking about it. I see more, and just, I've been in prevention for 20 years now. And in that time, I would say that there has been a huge shift in the desire for kids to say exactly what's going on. Still not as much help for them, but it has to be the right trusted situation and the right trusted individuals. And so I still see a lot of distrust, and especially for Black and brown students, because that message is still at home. Don't trust, for valid reasons. Don't trust. So there is a shift. There's definitely a shift. We are still left with not enough services and not enough resources to deal with everyone. And also, if I want to go get healthy, I know, stop eating those red vines in the morning and go for a jog. I know that, right? But what do you do when, mentally you're like, I need to get healthy?
And then the second part to that, when they do go seek help, are there, because I know if we go to the hospital, they still say, you're probably not in as much pain as, maybe a non-melanated person would be. Oh, yeah. Do you see, does that happen in mental health as well when we do go seek?
Yeah, that's something that I don't know at what point we can overcome that, but that's something we have to make a concerted effort towards. Because remember, when we're talking about the layers of trauma that I'll use your word, a melanated person has experienced, that person in front has to have a level of awareness. Has to. That person sitting in front helping can't be a person who's at no awareness, can't be a person who's in denial, can't be a person who's kind of like, I think there's an issue, but I'm not really sure what to do about it. That person has to be pretty far up the spectrum to be able to help. because some of the issues are going to be very specific to that person, but some of the issues are going to be specific to an entire population of people. So finding the right person is really important. And that's anybody looking for mental health support. Don't think that you have to go to that one person and that's a fit. No, it's not one size fit all. You have to find the person that works for you.
Okay, so Joronda, I got a chance to watch a movie, the short film or whatever, and I have to tell you that it was an amazing film. It brought so many tears to my eyes because so many of those stories touched close to home for me. So after watching that, talking about what we're talking about, what kind of things do you think we should start doing in our community to start changing some of the mental health issues that we have?
Well, one, we have to have way more communication, way more opportunities to communicate. When our kids, our young people understand that auntie is not there just to be auntie, and that's bomb, that auntie is auntie, but auntie is there to also talk to me and understand and be able to put herself in my shoes when auntie was in the 8th grade or auntie was in the 10th grade, So conversations, we need to have way more of those conversations. We also need the tools to intervene. We've had tools that we've used for a long time, and we don't want to get rid of those tools, like going to faith is a big tool, in the Black community, and family reunions. That's something that I think that's very particular to the Black community. I don't know that you see family reunions the way that we do it anywhere else, right? Mm-hmm. And definitely having the family reunion and making sure that our young ones feel included, so make that a part of the family reunion, a tradition, mm-hmm. and keeping the family traditions. Like when family traditions, just because grandma or grandpa died doesn't mean the tradition has to die with them, developing a level of pride because I'm a part of this family and I'm a part of the Black family, but I wear this last name of this family, or I'm, kin to these people. I'm the daughter of who is the daughter of who is the daughter of, developing that level of pride. All of these things layered on top of each other can just help us to add on to the strength that we already have. And vulnerability. Vulnerability is one place where over the years, and this is historical trauma, we have been literally and figuratively beaten to submission to not be vulnerable. Because if too vulnerable, go ahead.
No, when you say vulnerable, submission, these are all words that kind of go along with the way Jim Crow had adjusted us for. So yeah. It's kind of embedded in us to kind of lay down and accept what someone else is saying is right. And we lose sight of fighting for what is right for our own.
Yeah. Yeah. I did what I call the More Than Strong challenge. This was my response to George Floyd. And in that, it was targeting Black women who had been the stereotypical Black women. If you've just relied on your strength, I started seeing more Black women attempting suicide and completing suicide. I had never known anyone Black in my circle to attempt to die by suicide. Let me say that. And we were all hit with a very surprising situation when a friend passed away. And I kept hearing Black women saying, I'm not okay. And that was the first time as a Black adult woman, hearing a Black woman say, no, I'm not okay. Because it had never been okay to say, I'm not okay. You just had to be okay. Grandma was at church every Sunday, making sure that the usher board was taken care of, the collection was taken care of, the food was going to happen after church, all of this. And she wasn't always okay. But she didn't have the ability to say, I'm not okay, because then people would be like, oh, something wrong with her. Or a lot of times we start to get that word, oh, she's crazy or he's crazy, that kind of thing. And so, I did this challenge to help us understand what are these types that we fit into. We tend to be dedicated. We tend to be trustworthy, and we tend to be overly accommodating. And those things, if you're not that, you're an angry Black woman. If you stand up and speak up for yourself, oh no, she can't do that. Everybody else can, but she can't do that. She has to fit into this particular box. And we can see it in movies. We can see it in films. We can see the overly happy Black woman who's just happy to do everything for everyone. Yes, sir. In some of the older films or whatever. And we live that. Or we can see the very sensual, promiscuous, Black woman, and that continues in film today. And our girls are seeing this, our young girls and our young boys are seeing this. She has to fit into a category to fit into the mind of what people have designed the Black woman to be. But no, she has the ability to design herself, and she has the ability to make sure that Black boys and girls understand who she is so they can understand who they are. And oh my gosh, you guys can get me on this historical trauma trail and understand the impact that that's had on our Black men and Black boys. The threat of stigma is even bigger for our Black men. Our Black men do not want to be stigmatized. And in fact, I recently heard that because of protests, Black men, the diagnosis of schizophrenic was disproportionately given to Black men, because if they would say something like, like the man is after me, or the man, wants to get me down, they were considered crazy, like something was wrong with them. And so they were overly given diagnosis of schizophrenic. And you get a diagnosis that is to some extent based on the opinion of a doctor. It's not, there's not always a particular metric that is used, which everybody uses the exact same, like you can't move out of this line or this line. There is some opinion that's in there. So yeah, it's had a profound impact on who we are as people and as families and as a population.
So where can we go to get help for as mentorship, accountability, or just help for kids, adults, men, women? Where can we go?
In your communities, you want to start with kind of doing some searches of who are the mental health providers. That wouldn't be a general medical practitioner. It's not like your pediatrician. It's not like the emergency room. They deal with physical health. But if you trust your pediatrician, if you trust a health provider, you can get a resource from them. They do talk, they do communicate, people do give referrals. Referrals go a long way. So that's one place. Now, thanks to the pandemic, you can do it online. You don't have to just go into an office. You can do health, physical and mental health services online. So check out some of the online resources. You can go to Mental Health America. Mental Health America has a tremendous amount of information. And you can look for the, what do you call that? I'm trying to say the trackers, or where you can query it by your zip code or your state to see where people are. 211 is a place where and I'm just giving general places to start, right? General places to start where you can just kind of start to look at what's available in my area. And then we need to be creating some of these opportunities on the ground in our areas. The providers who are in the area who can service and understand, those providers should be brought together to bring some information to the community, just like this, just like in the podcast, but then also making sure that those happen in the churches, in schools. I was allowed to do some mental health trainings for a couple churches here in Phoenix. We did it online. Everybody couldn't be there. It was right at the end of the pandemic. People still weren't coming out. And we had a good number of people online to hear and understand what you do in your home, how you get outreach to people to do something beyond what's happening in your home, and how you continue to stay well. We are not waiting until there's a crisis. When you wait until there's a crisis, we're talking about treatment. Treatment is good. It has its place. And keep healthy kids healthy. Kids don't come here in crisis, typically. They don't come here in crisis. They don't come here with thoughts of suicide. They don't come here looking for a substance to deal with whatever the issue is. So let's keep healthy kids healthy so that the next generation can be much healthier than we are. And that's now. That is right now. There's kids born every day, and there's elementary and middle school kids right now. Yeah.
Okay. So this next section is our rapid fire. So quick 20-second answers, whatever comes to mind. And so this first question, you kind of already answered, but what's your why?
Oh, my why 100% is because of the way I was raised, and I need to be who I needed when I was in the 9th grade.
Okay. Were there times that you thought that this wasn't going to work for you?
There were times when I felt down and broken, and then all of a sudden I have a kid who says, you know what? I saw you and you were in my class, and because of you, I'm alive.
All right. What's the most important thing you have learned in your life so far?
Be authentic.
Okay. I know y'all gonna laugh at me for this one, but how do you manage your work life, professional life, and your family life?
You know what? I don't know any better, so I don't compartmentalize. They all get what what everybody gets out in the world.
Okay. If you could turn back time and talk to your 18-year-old self, what would you say?
Keep going. You're going to make a huge impact on people.
All right. If you could sit down with and have a conversation with one person, dead or alive, who would it be, and why?
Ooh, my goodness. My great grandmother.
And why?
Because there were so many questions I didn't ask her about her grandmothers that I wish I had.
Okay.
Okay, what's the most important thing that you've learned in life?
Stand by my faith.
Okay. People always say you should invest and save money. Are there things that you invest in?
Yeah, 2020 has me investing in the stock market. I'm in there 100% in the stock market.
For sure. If you could recommend one book for us to read or the people that's listening, what would that book be?
A book that I'm reading right now is called Start With Why.
Mhm.
And it's just had a pretty profound impact on me. So right now, I would recommend that one.
Okay, what are some of the best tips that you can leave us with to making our community better?
Talk early, talk often, and talk authentically. Don't always punish. Don't punish. Don't punish at all. There should be consequences for everything, and that shouldn't be steeped in punishment. So we definitely need to make sure that we've got each other's back. And one thing I always say when I'm in front of a group is, I got you.
I got you.
Okay. How do you celebrate your wins?
I like cold, frosty drinks. And so I'm always in like a Dutch Bros, or I know you guys don't have that in Southern Cali, but a Dutch Bros or a Starbucks or something like that. But I like cold, frosty drinks. Annually, I celebrate my wins by giving gifts on my birthday. I just had a birthday. And so that's what I like to do.
Oh, that's cool. That's different.
Yeah.
I like
Uh,
that.
so we're at the point now where the interview is pretty much over. So how could the people find you if they want to get in touch with you?
And your movie.
Oh, okay. You can find me directly. You can go, I leave my Instagram completely open intentionally because I'm in front of thousands of people annually. So my Instagram is Joronda Montaño. There is only one. If you find her, she is me. There is no other Joronda Montaño on this earth. So you find me on LinkedIn, you find me on Facebook. I have to vet you on Facebook, Snapchat, Instagram. That is where you can find me directly. I am in the process of relaunching a company that I founded a few years back, and now that I'm on my own, and I've been on my own for 2 years, NeckUp CheckUp is my company, and we do mental health checks and make sure that people understand educationally what's important, and do some training to give people the tools to intervene when necessary in mental health first aid. But NeckUp CheckUp coming soon. But if you go to my LinkedIn, you can stay abreast of what's happening with me there and make sure that you know when the new NeckUp CheckUp website is launched.
Hey, you guys. So this was a good interview. So Rhonda, tell me one thing you want to leave the people with after this interview.
Oh my goodness. You guys need to be good to each other. Like for real, be good to each other. You don't know what's going through someone's head. When someone is walking down the street or walking into work or walking into the house, you don't know the video that's playing in their head. You don't know the soundtrack that's playing in their head. Like, be easy with people. Be good to each other. Like, just understand that we are all trying to move through this thing. We all deserve happiness, and every day is not a happy day for every individual. Don't contribute to the unhappiness. Just be easy and be good with each other.
All right,
That
cool. Mr. Caliph, what do you want to leave the people with?
Sis, I really, really, really appreciate you. I see you out there in the track world. I know what Southern California means to you. I know what you mean to the track world, and not just you, your family as well. Because when it comes to high jumping or jumping, period, better not nobody do it without talking to your husband first. So, for me, I thank you so much for what you do for our community, what you do for our people, what you do for the youth, what you do for everybody. I really appreciate you. And I really want to thank you for that movie you put together. For me, it touched me in a different spot. I went through it growing up. My mom is a product of growing up in the 80s in Southern California, and my family went through it. So I know what it means to actually see that film, and it hit so close to home. And I just want to thank you for everything you do.
Thank you. Thank you. I didn't tell you guys where to find it, but if you want to say where to find it, it's just The Preventionist. If you Google Joronda Montaño, The Preventionist, it's a mini doc that PBS put together.
Yeah, and we'll put it in the show notes for the video once it go live. Ms. Brown, what do you want to leave the people with?
Forgive yourself too. We all go through stuff. You got to be able to forgive yourself.
I want to leave the people with, hey, you guys, if you're going through something, just make sure you're getting some help. Get somebody to talk to, reach out. And we got problems, you guys, but we also have solutions. And I'm out.
Peace.
From the team at CRC Empire, we want to thank you for listening. To stay connected with us, like, share, and subscribe to the We Got Problems podcast. You can find us on social media platforms at Curtis Martin 247, at Rhonda Wrights Official, and at the_trash_vegan_. We got problems and we got solutions.